Welcome to G Fun Facts Online. Today, we're diving into a silent revolution happening in India. It's not a political or technological one, but a profound public health crisis that's reshaping the nation. While the world often hears about India's successes against infectious diseases, a new, more insidious enemy is on the rise: non-communicable diseases, or NCDs. This is the story of India's great health divide. Let's get straight into it. The numbers paint a stark picture. Back in 1990, these chronic diseases, think heart attacks, diabetes, cancer, were responsible for about 38% of all deaths in India. By 2016, that figure had jumped to nearly 62%. Projections suggest that by 2030, NCDs could cause 3 out of every 4 deaths in the country. This isn't just a health problem, it's a massive social and economic challenge. Health experts call this the dual burden. India is still fighting communicable diseases like tuberculosis in many regions, but now it's simultaneously facing an explosion of chronic illnesses that were once considered problems of the wealthy. This two-front war is putting an immense strain on the entire healthcare system. So what's causing this dramatic shift? In a strange way, it's a side effect of India's own success story. As the economy has grown, life expectancy has increased. A larger, aging population is naturally more susceptible to chronic diseases. But the bigger story is urbanization. Millions of people have moved from physically demanding farm work in rural villages to more sedentary office jobs in bustling cities. They've swapped walking for motorized transport. At the same time, their diets have been completely transformed. Traditional, home-cooked meals are being replaced by affordable, processed foods packed with salt, sugar, and unhealthy fats. This is the nutrition transition, and it's a primary driver of soaring obesity rates. There's also a social shift. The traditional joint family structure, which provided a strong support system, is giving way to smaller, nuclear families. This, combined with the relentless pace of modern life, is leading to increased stress and mental health issues, which are closely linked to physical NCDs. Now, let's zoom in on the main culprits, what some are calling the 4 horsemen of this NCD apocalypse: cardiovascular diseases, diabetes, cancer, and chronic respiratory diseases. First, cardiovascular diseases, or CVDs. This includes heart attacks and strokes, and they are the #1 killer in India, responsible for 1/4 of all deaths. The death rate from CVDs in India is significantly higher than the global average. What's truly alarming is how early it's hitting people, often striking them down in their most productive years. The risk factors are everywhere. A 2023 study by the Indian Council of Medical Research, or ICMR, found that over 1/3 of adults have high blood pressure. Almost 30% are obese, and nearly 40% have abdominal obesity, that dangerous belly fat. Add to that high cholesterol, and you have a perfect storm for heart disease. Next up is diabetes. India is often called the, quote, diabetes capital of the world, and the title is grimly earned. The number of people with diabetes has skyrocketed from 26 million in 1990 to 101 million in 2021. But here's the truly frightening part. An estimated 136 million more people have pre-diabetes. That's a ticking time bomb. It means 136 million people are on the verge of developing full-blown diabetes. This epidemic is directly linked to the lifestyle changes we just talked about. Once a disease of the urban rich, diabetes is now rapidly spreading into rural and lower-income communities, as processed foods and sedentary habits become more common. The third horseman is cancer. It's a growing menace, with an estimated 1.46 million new cases in 2022 alone. India ranks 3rd globally in the number of cancer cases, trailing only China and the United States. The statistics for women are particularly devastating. For every 2 women diagnosed with breast cancer, 1 dies from it. And a woman dies from cervical cancer every 8 minutes. For men, cancers of the oral cavity and lungs are the most common, largely driven by high rates of tobacco use. These 4 cancers, breast, cervical, oral, and lung account for more than half of all cancer deaths in India. Finally, let's talk about chronic respiratory diseases. Conditions like chronic obstructive pulmonary disease, or COPD, and asthma are a massive public health problem. India bears a disproportionate share of this burden, accounting for 32% of the world's disability and death from these diseases. The number of COPD cases more than doubled in 2 decades, from 28 million in 1990 to 55 million in 2016. A major contributor is air pollution, both outdoors in cities and indoors in rural areas where millions still cook using biomass fuels like wood and dung, filling their homes with toxic smoke. India also tragically leads the world in asthma-related deaths, accounting for a staggering 43% of the global total. This NCD crisis doesn't affect everyone equally. There are deep fault lines running across Indian society. For a long time, these were seen as diseases of the city, but the tide is turning. Urban lifestyles and diets are penetrating rural areas, where awareness is low and access to healthcare is poor. A farmer developing hypertension might have to travel hours to see a specialist, pay for it out of pocket, and struggle to find the right medicine. This often leads to catastrophic expenses that can push a family into poverty. This brings us to another major shift. Historically, NCDs were diseases of affluence. Now we're seeing a, quote, reversal of the socioeconomic gradient. While the rich still get sick, risk factors like tobacco use and unhealthy diets are becoming more common among the poor. When you look beyond self-reported cases and use proper screening, the prevalence of many NCDs is actually higher among lower socioeconomic groups. They are underdiagnosed and undertreated. This makes NCDs not just diseases of affluence, but increasingly, diseases of poverty. The economic fallout is immense. The cost of treating these chronic conditions, combined with lost productivity from people getting sick or dying prematurely, is estimated to slow India's economic growth by 5 to 10%. For families, the burden is crippling. One study found that about half of all families dealing with cancer face catastrophic health spending, with a quarter of them being driven into poverty as a result. So, what is being done? The government of India has recognized the crisis. In 2010, it launched a national program for the prevention and control of NCDs. This involves setting up NCD clinics and screening people over 30. More recently, the Ayushman Bharat scheme, launched in 2018, aims to create a network of health and wellness centers for primary care and provides health insurance for vulnerable families to cover hospital costs. But the challenges are huge: a shortage of trained staff, logistical hurdles, and a fragmented system. While these government efforts are crucial, one of the most exciting frontiers in this battle is technology. Digital health could be a lifeline. The government's Ayushman Bharat digital mission aims to create a unique health ID for every citizen and build a connected digital health ecosystem. Imagine what this could mean. Mobile apps can help people track their diet and exercise and send medication reminders. Wearable devices can monitor vital signs and flag potential problems early. Telemedicine is a game changer, connecting a patient in a remote village to a heart specialist in a major city. Artificial intelligence is already being used to analyze medical images to detect diabetic eye disease or certain cancers with incredible accuracy. However, challenges like digital literacy and internet infrastructure must be addressed to unlock this potential. So, what is the path forward? There is no single magic bullet. First, the primary healthcare system must be strengthened, especially in rural areas. We need more funding, better infrastructure, and more healthcare workers trained to manage chronic conditions. Second, the focus must shift from simply treating disease to preventing it. This means creating a healthier environment through policies that promote better food, encourage physical activity, and reduce tobacco and alcohol consumption. Third, individuals and communities must be empowered with knowledge. Public awareness campaigns are vital. And finally, this can't just be a job for the health ministry. It requires a whole-of-society approach. The departments of agriculture, transport, urban planning, and education all have a role to play in building a healthier nation. India is at a critical crossroads. The silent ascent of non-communicable diseases is a wake-up call that demands a massive, collective response. By investing in prevention, strengthening healthcare, and harnessing technology, India has the opportunity not just to fight this crisis, but to build a healthier, more prosperous future for all its citizens. Thanks for tuning in to G Fun Facts Online.